Hi, Dr. Windisch again from Sparks Pediatric and Adolescent Medicine. I've been asked not to wiggle too much for this video, so I'm going to sit still. Welcome to our video blog for parents. Today we're going to talk about constipation. Remember that this video is not intended to replace visits with your physician, so if you have questions or concerns, please make an appointment to be seen by your doctor. If we can help you, you can call us at 775-359-7111. Remember, we're happy to get you in the same day if we need to. So constipation for children, this is a very common complaint in our office. We probably see 2 or 3 children a week with this as a chief complaint. And what I want to address really is constipation for older children, so children 2, 3, 4, 5 years of age. Newborns is kind of a different sort of problem. First, we need to define this and make sure we're defining it properly. Constipation is defined as hard or large stools or poop on a regular basis. If it's just once, nobody cares. If it's just that you haven't gone for a couple of days, it's still normal as long as things are soft and painless. If it's painful, if it's large, we have a problem. This may or may not result in bleeding when the child passes stool, and that of course can be a problem. Untreated, this can be severe because the children quickly learn that it hurts, and then they start to hold on to things and back up, and things just get worse. So prompt addressing of the problem is important. Aggressive treatment is important. Long-term treatment is important. For children who truly are constipated, many times by the time the parents have figured out what's going on, they've been, especially for school-age kids, they've been constipated for a good 6 months before you even knew there was a problem. So what do we do for this? Well, first thing we need to do is a very thorough exam, because the list of things that can cause constipation, besides just plain old functional constipation of childhood, is huge, and some of these things are terrible, including but not limited to tumors in the sacral area, muscle diseases like Duchenne's muscular dystrophy as a presenting complaint, diabetes. So these things need to be ruled out, and we do that with a very thorough, very careful physical exam. And then we need to treat it. We can treat it with any of a number of medications, some of which are prescriptions, some of which are over-the-counter. And the goal with these medications is to clean out your child's intestine, get rid of the hard poop that's in there. Then we need to prevent it. And the prevention is the key, because what happens is over time, your child's intestine, which is made up of muscle fibers, hopefully this is in the video, those fibers overlap. As you become constipated, those fibers stretch and those muscles no longer overlap, so they don't work real well anymore. If we do nothing and simply clean you out in another 6 months, you'll back up, be back in my office with the same problem. So how do we prevent this? First thing we do is called time toileting. We want the child to sit on the toilet for 5 minutes twice a day, after breakfast, after dinner. This takes advantage of a reflex that we notice most obviously with babies. Every time a baby eats, they poop. Well, older people have that same reflex. We just suppress that urge. We want to take advantage of it. So after the child eats, we want them sitting on the toilet. They don't have to poop, but they do have to sit on the toilet. Many kids of this, especially kindergarten, first grade age, are so busy doing things, they don't take the time to attend to their body's needs. And by making them take time and put attention to their needs, the problem solves itself. So they do have to sit there for 10 minutes, 5 minutes twice a day. Don't have to poop. We can't make them poop. We're not going to try to take control of this. We can control when they sit on the toilet, and that much we're going to take control over and make them do. Number 2 is a high fiber diet. And a high fiber diet is defined as your age plus 5 grams of fiber per day, and you need to count grams of fiber. Grams of fiber are written on the box if you're using prepared foods like cereals and breads, and you can look up the fiber content of fresh fruits and vegetables on the internet. To be perfectly honest with you, with the exception of 1 or 2 Hindu patients that are patients of mine who are complete vegetarians, don't eat meat, I have yet to meet a child who eats a high fiber diet. So when the parents tell me a child's eating a high fiber diet, it's not a medical high fiber diet. You've got to count the grams of fiber. You will be surprised how little fiber your child is actually getting in. So a 3-year-old needs 8 grams of fiber, a 4-year-old needs 9 grams of fiber, a 5-year-old needs 10 grams of fiber, and so on per day. The fiber and the time toileting are for the rest of the child's life. These are habit changes, a habit we need to get into forever. So this is lifestyle change. But better to change this lifestyle than having to change other things later on, like being in and out of the hospital for clean out. Finally, we need some preventer medicines to keep you from backing up. And there's a number of preventers we use. Sometimes we use mineral oil. Sometimes we use Senecot. Sometimes we use milk of magnesia. Sometimes we use something called Miralax. And the goal here is to keep the poop soft and keep the child pooping at least once every day or two for the next 6 months so that they don't back up and so that things aren't painful and so we can break that cycle of pain, stool retaining, more pain, more stool retaining, bigger, larger, harder stools, more pain. When we keep them going every day, we avoid these problems. And we do that for a minimum of 6 months. We do a trial off of the medications, see how the child does. If they back up again, we go back on for another 6 months. Usually with 6 to 12 months, the problem is corrected itself, as long as the child continues on a high fiber diet, continues with time toileting, and continues to drink plenty of fluids. And by fluids, I mean not milk, not juice, but water, which many children drink too little of. I know this is kind of a long discussion of a complicated subject and a very common subject. If your child doesn't like fiber, doesn't like fruits and vegetables, that's where fiber supplements come in. There are dozens over the counter on the market between tablets, powders, cookies, crackers. Just make sure it adds up to age plus 5 grams of fiber per day. Thank you, Dr. Nanjandaya. This is Dr. Kevin Windisch. I hope this has been helpful for you. If you have questions, if you think your child is constipated and needs a clean out, give us a call, area code 775-359-7111. We'll see you next time.